Hi, everyone. Welcome to Office Hours, Maximize, Maintain, and Expand Your Results. My name is Mia, and I'm going to be co-hosting the event tonight. Today, we're joined by Dr. Brandon Kirsch for a live interactive Q&A. Dr. Kirsch is Musely's Chief Science Officer and board-certified dermatologist based in Naples, Florida. He's valued the Musely team, and we're so excited to have him here with us today. So we're going to get started. So our first topic is going to be how to maximize your results with Musely Face RX treatments. So Alicia, Keisha, and Carla all asked, how do you get the best results possible and speed up the process with the spot cream?
Well, thanks for the great introduction. It's wonderful to be here and see all these friendly faces. I'm looking forward to a wonderful discussion. That's a great question. It's on everybody's mind. I think the most important thing, there's some fundamentals. First is you have to be really disciplined. It's kind of like going to the gym. You know, you decide it's a Jewish New Year, so Happy New Year to anybody who celebrates that. I do. It's time for resolutions. If my resolution is I want to lose weight or I want to get in better shape, that's a commitment that I have to make on a daily basis to reach that goal. So every day I have to work at it. You have to have compliance. So the first thing is going to be compliance. You're going to have these treatments from Musely. The vast majority of them are daily treatments. So they require to use them daily to stay committed to them and to continue to use them. If you stop using them, if you take breaks, if you aren't consistent, it's going to take a lot longer to get the results that you want. And it may not be possible to get those same optimal results that you were hoping for. In terms of the skin treatments, you have to be very good about sun protection. The number one cause of dark spots and aging and wrinkles on your face is sun exposure, chronic sun exposure. So an ounce of prevention is worth a pound of treatment. And if you're going to commit to getting great results and making your skin look better than it's looked, then you have to be committed to really good sun protection. That means wearing daily SPF 30 or above. I recommend a mineral sunscreen. Interestingly enough, and I can go on tangents, so I'll try to answer your question a little bit more directly, but this is just a passion of mine. It's just very interestingly enough, there are two broad categories of sunscreen. One is a chemical version. So when you read the active ingredients, it's like these really long organic chemistry sounding names. And then the other kind are mineral. And those are the simple ones. There's really only two. So it's zinc oxide and titanium dioxide. Now, both of these work really well to prevent skin cancers, which is like the primary reason why people recommend and use sunscreens, but they don't work equally to prevent the signs of aging and dark spots. The mineral sunscreens have a much broader spectrum of protection, and they protect you from those UV rays that actually are causing those age-related changes in your skin. So you need to have a good SPF, like the day cream from Musely. They all have mineral ingredients included for that exact reason. You don't wear sunscreen, and especially if you live in a warm climate like I do in Florida, and you go outside for even 10 minutes, you can very quickly reverse all of your improvement. And some treatments like the tretinoin and the anti-aging can actually sensitize you a little bit to the sun because they're like an exfoliant and they're removing dead skin on the surface of your face. That dead skin is a small grade of SPF. So when you lose that, you're actually going to be more sensitive. So if you're not very careful about avoiding the sun during peak hours, wearing a big hat, and really applying and reapplying that SPF, you're going to have a hard time getting the results that you want. In terms of speed, everyone wants this to happen so fast. You know, I want to get a six-pack. Like, how do I get that six-pack so fast? Like, that's not going to happen. It's going to happen if you stay at it and you comply and you work at it and you're disciplined. Everyone's going to be a little bit different. Everyone's going to come to the place where, you know, to start the starting gate from a different place. Some people are going to have more wrinkles. They're going to have more dark spots. Some people are going to be older. Some people are younger. They're going to have different ethnic backgrounds. So there's not one way to get faster. You know, you see some really amazing results on Musely. Some people are just lucky, like, you know, about 5%. The most of the people, it's going to take 8 to 12 weeks to really see results. And probably the most powerful benefit of Musely is that you literally have a dermatologist accessible to you just about effectively 24 hours a day, 7 days a week, who can help guide you and make adjustments to your treatment plan to get you the results that you want. You got to work at it, and you got to wait about 8 to 12 weeks. So that's 2 to 3 months to see improvement. If you don't see improvement after 3 months, if you're really not getting to where you want to be, that's a time that you can check back in. You can check back in anytime, honestly, but you are definitely going to really want to check back in and tell your dermatologist that, you know, I'm disappointed because I haven't gone there. And that happens. You know, everybody's different. If you're committed to the process with Musely, there are no better treatments available for the indications that we treat, and there are really not better experts that are going to help you, because the doctors on Musely are treating hundreds of thousands of patients. You know, I personally treat, I don't know, I have to ask Mia or whatever, but thousands of patients a month, definitely. I mean, just on this platform alone, let alone in my clinical practice.
This is a commonly asked question. Why do we get dark spots, and how can we prevent them?
Yeah. Well, the number one cause is definitely going to be the sun. I had a Dalmatian, it was born, it was totally white, basically. It's kind of interesting. And then over time it gets dark spots. Now, obviously those dark spots are from the sun. Some of your dark spots are also going to be genetic and hereditary, and your sensitivity to the sun is also going to have a factor. But the number one environmental cause of that, aside from just general aging, which actually is not as important, is sun. So sun is going to be much more important. And you can tell, because if you look at your skin, like the underarms of your forearm and compare it to the top part that gets the sun, or you look at your face and compare it to your backside. When I see backside, I do full skin checks, and you see the backsides of 80-year-old people, and they don't have one spot on it, on the buttock. It's totally clear. The only reason why that's different than anywhere else on their body is the less exposure to the sun. Genetics definitely plays a part, but the part that you can control is the sun. I know that another reason people do get epidermal hyperpigmentation, that's like general broad category of superficial kind of dark spots. When we talk about one in particular, a type of that, it's melasma. There's definitely a hormonal component. So I don't want to discount that also. If you have melasma, which is kind of a distinct pattern of epidermal hyperpigmentation, where you've got like these broader patches on the cheeks, forehead, chin, even on the upper lip, which is like that very dreaded melasma mustache, which we can help you with, but I totally understand why it's dreaded. That's definitely made worse and contributed. The sun contributes, but there is an underlying hormonal component, which I factor in kind of, that's your genetics. So those two go together. And when you get pregnant or at different stages of your life, or if you're on birth control, like these things can kind of change your hormones.
Connie asked a question in the chat. Connie, are you able to share?
When I'm done with how my melasma looks, how often do I use the spot cream?
Yeah, people have these dark, whether it's sunspots or melasma or whatever the epidermal hyperpigmentation is that you're experiencing, post-inflammatory hyperpigmentation from dark spots you get after acne or a bout of eczema or whatever. You clear that, you're super happy. Do you need to be using this intensive, clear formula every day like you were? Absolutely not. Okay, so this is a good opportunity for two different things. One, to use the anti-aging. So the tretinoin, very good for fine lines and wrinkles and your overall complexion and glow and the softness of your skin. And it also has a beneficial effect for hyperpigmentation. So it will keep kind of that hyperpigmentation a little bit at bay. It may flare through it, and then you need to treat it again. But you don't necessarily need it every day. You can experiment. Everybody's going to be different, so it's hard to say. Plus, different environmental factors. Are you going to get a little bit of sun? Are you going to be on vacation? Do you live in a warm place? But you can titrate it down. So in terms of like an plasma treatment, spot treatment that we have on Musely, like the M+ formulation, 12% hydroquinone.
That's what I'm thinking.
Yeah, if you're using that, or you're using the Erase, which is 12% without the tretinoin, you can decrease it. You might want to go to every other day, see how you do. Maybe you end up just doing it 2 times a week or 1 time a week. But I do think you should always have something daily. It's a great opportunity to do something daily to make your skin look better anyway, and to reduce the likelihood that you're going to have a flare, minimize the flares as well. So that's what I would recommend. Everyone's going to figure out. It's the same question with the spot pill. It's a great treatment that kind of complements the spot cream. And initially, actually, we give the spot pill. You take it morning and night, 1 pill each, just to be really clear. Sometimes there's a little bit of confusion about that. And then that's for 3 months. And then you just go to every day. And then occasionally someone will flare and they can order it to get twice a day. So it's the same thing. You're going to titrate it. And actually, some people, down the road, you might need to take that every other day. So you have to play with that a little bit and just titrate it down based on kind of your responsiveness, where you're at as an individual. And your dermatologist can help you, but that's kind of a general framework of how you think about it.
Thank you. And does the peeling ever stop?
Yeah, you know what? Here's the thing. I don't like the peeling, okay? So there's a lot of controversy about the peeling, because I'll get a lot of patients who will get a little agitated that they didn't get any peeling and they don't feel like it's working, or redness. Personally, from my experience, certainly peeling and redness can be a sign that it's working. I think that's fair. I know you can have it work without that. So that's another thing. You have to titrate your treatment. Some people are more sensitive than others. Some people, they put the better in, that's the 0.1%. They do this, they do that. They use a bunch of things that I would tell them to never use, different like hydroxy acids or whatever in combination. Everything, their face is like unbelievable. It doesn't peel or anything. Other people, you put a tiny bit of the most gentle tretinoin and they're going to start peeling. I don't want peeling. That's not, you don't want to go through your life peeling. That's not a good look. We want your skin to be look beautiful. Yeah. So if you're peeling, regardless of the treatment, you can effectively dilute it. So there's 2 things you can do. One is you can use it less frequently, and 2 is you can dilute it, and you can do those in combination. So for something like the M+, which is really strong, it's very easy to dilute it. And when I say dilute it, you can do 1-to-1 with moisturizer. You can do 2 parts moisturizer to 1 part. You can do 10 parts moisturizer to 1 part. And then just kind of figure it out. dilute it. I think it's good to do it daily, at least, especially if you're trying to get that clearance. So it's better to dilute it more and use it every day. Once it's clear, then you can use it less frequently. And then as you talk, your skin generally does harden to the treatment. So you should eventually gradually get used to it and not have the peeling as much. But while you're in that process, it's really good to dilute it, I think. And
Okay.
then I tell everybody, I'm like emphatic about this, is I love this thing called the moisturizer sandwich. This is my favorite general skin tip. Okay. This is how I would go about, this is how I recommend to my patients, and I would go about doing it myself, or I do it myself, to be totally transparent. Okay. You clean your face with a gentle facial cleanser. You pat it dry. Actually, if you apply these treatments to your face is too wet, it can increase the likelihood you're going to have irritation because it increases the penetration of the medicine. It has an effect on the penetration, how much effective medicine you're going to get if your skin's too wet. If it's too wet, it's just going to all run off. If it's a little too damp, it's going to be a little bit stronger. And if it's drier, it's going to be less strong. It's going to penetrate less. So what I would recommend is that you gently cleanse your face. You pat it so it's mostly dry. You don't want to be treating your skin roughly because that will also increase the likelihood you're going to get irritation. And then you prep it, okay, by putting on a layer of plain moisturizer. Then on top of that plain moisturizer, then you layer on your Musely treatments. If you're just using the spot cream, then you just use a spot cream. If you're using the spot cream combined with the anti-aging, then you do one and then the other. It doesn't actually matter the order. There's a lot of controversy also how long you have to wait. I'm one, I just put it on. I don't think you really have to wait. If you want to, there's not good evidence one way or the other. There's a lot of, people have different theories about why it would work better one way or the other. I think if you wait at least 30 seconds, then you get the best of both worlds. So you moisturize, wait 30, which is nothing. Put on a layer, wait 30 seconds, put on the next layer, then have another prescription. And then the sandwich part is to put on another layer of moisturizer. Now, this is a twofold benefit because one, you're going to get less irritation. And two, you're going to moisturize your skin more. And actually, moisturizing your skin has its own independent benefits. I mean, all things equal, aside from sunscreen, if you're not doing an actual targeted treatment, moisturizing your skin is going to make it look more plump. It's going to be softer. It's going to be more resilient. It's going to be less friable. It's going to feel, it's obviously going to be less dry, be less likely to get itch. So moisturizing your skin, drinking lots of water, those are great things to do just at baseline. So that's my advice, that moisturizer sandwich, dilution, and then kind of titrating how often you use the treatments.
So you put moisturizer on first before you put any.
Yeah.
And it won't dilute the products.
It won't negatively impact the efficacy.
Okay.
Because actually, I think there's, this is something that would require a lot of, this is anecdotal, but anecdotal thousands and thousands of times in experience, okay, about why this is or whatever. But there's one aspect that, yes, okay, you're putting this moisturizer on. Are you slightly diluting the product? I think effectively it's a very minimal amount of dilution. The other way to look at it is if you apply the product and then the top layer of the moisturizer is actually an occlusive layer. Technically, when you occlude a medicine, which we do a lot in dermatology purposefully, like put a medicine on and put something on top to occlude it, it's going to increase the penetration. So I think on the balance, if anything, you're probably going to get a little bit more penetration, but it will definitely mitigate the irritation. So I would not worry about having less efficacy. And I've been doing this for a long time.
Thank you.
Yeah, my pleasure. Great question.
Okay, yeah, that was a really good question. I was I wanted to know that also, so thank you. Okay, Caitlin asked another common question, and I hope I'm saying this right. Madavi also asked in the chat. It's how safe is the higher concentration of hydroquinone long term?
Yeah, this is a question that comes up a lot. My high level answer is that it's very safe, especially the way that it's prescribed on the Musely platform. So the biggest concern with a high concentration of hydroquinone taken for a chronic over a long period of time is that you can get this rebound pigmentation. Special technical name is called ochronosis. So effectively, you're getting a great result, you keep using it, and then all of a sudden your skin starts getting darker and worse, and you're getting the opposite of what you want. And the reason that this happens is there's basically three reasons why this happens. Okay, one is a really low quality product. We don't actually see this a lot in the United States with the ingredient that we use because it's just created at a higher quality. I'm not sure what makes a better product in the United States and somewhere else, but we see this in cheaper products in foreign countries, like third world countries. So if you're getting your hydroquinone off the shelf or whatever from a developing country, that's where this problem really comes up a lot. That just, I guess, has to do a lot with the purity of the product and quality of it. So that's one problem that we don't have at Musely. Another reason that people get this is not something that really affects people have lighter skin. So if you have like a lighter skin type, ochronosis is like exceedingly unlikely and rare. If you start to get like a little darker, like, and that means that you don't, the way that it's great is this Fitzpatrick skin type, but effectively, if you get to the point where like you never burn, you just tan or get darker, so you're more like Latin American skin color, East Asian, then African American, is that, again, that category, those are the people that are more at risk. The people who have melanin, a lot more melanin at baseline. If you're not in that category, then you really don't need to worry. If you're using a higher quality product like I'm using, your worry needs to go way low, reduce significantly as well. And then the next reason is that it's uninterrupted treatment. And that's the thing that's the most important. So the Musely plans all have breaks in them. And that's like the standard of care that we offer. Musely, we know what we're doing. We've done this for a long time. We're treating hundreds of thousands of people. These plans are experts in the field of treating hyperpigmentation. And so in general, just to be extra cautious and safe, you should only be on a high concentration hydroquinone for about 4 to 6 months and take a break for 2 months. There's a little bit of play that you can have. Maybe you take a break for 6 weeks, a month. It kind of depends on the individual and their skin type and how long they've been on it for. And that's something that your dermatologist will help guide you with. But every dermatologist I'm usually is like well aware of this very low risk potential negative side effect of hydroquinone. We take great care to avoid that. And so the short answer is that it's quite safe and well tolerated. There's no evidence that it would be like detrimental to a developing fetus or nursing infant, but we don't recommend it for pregnant or nursing women. And that's just out of abundance of caution. I mean, there's really no reason to take any risk when you're talking about what is effectively, cosmetic concerns. So we're very risk adverse at Musely, and we take great care to make sure that our products are safe for our patients. So there have been studies definitely where people took it a year and then had a break. So I think the safest route is 4 to 6 months. Take a break of 1 to 2 months, depending on your skin type. During the break period, we have hydroquinone-free versions of the spot cream. We also have the oral pill, which would be a good treatment for some people. And so we have ways of controlling the melasma, the hyperpigmentation when you're taking the break, but there's no ingredient that has the same degree of efficacy and evidence demonstrating efficacy as hydroquinone. So if you want to really clear your melasma, unless you have a history of ochronosis already, that's probably going to be a really good option for you and likely the best one.
We got quite a few questions about how to apply the hair solution. How much and how often should patients be applying it?
Okay, well, the hair solution comes in a dropper. The instructions are basically, I think the instructions still are 2 dropperfuls. I haven't looked at them on the bottle for that long, but basically the amount that's on the instruction is not really, is a guideline. Okay. It's not specific to each individual. Everyone's gonna be a little bit different. I mean, first of all, you might be a man who's just treating the crown of your scalp. So you're not going to need as much treatment as someone else who's trying to treat diffuse hair loss everywhere. Okay. But the general guideline is you just want a very thin layer of the solution on the affected area of the scalp. And that should be between 1 and 2 dropperfuls. And I wouldn't exceed that. If you put more on it, it's not going to get you better results. It's only more likely to give you irritation of your scalp. The product is very potent. And even at that, you may very well get irritation on your scalp. But the way to avoid that or deal with that, first of all, is not to use too much product. And I typically recommend just doing it once a day. If you build up if you're tall and have the treatment and it's not causing you to have any kind of irritation or itch, you can go to twice a day. And that certainly can give you some marginal additional benefit. But in general, I say just do once a day. If you do get any irritation, this is a product that you really should use every day. So you try not to taper this one down like I was saying you could do, for instance, for the spot cream. You want to try and use it every day. So there's an over-the-counter solution called Scalpicin. It's a solution of hydrocortisone, which is a topical steroid, very mild. And if you get in a situation, which has happened to me, I use the hair solution where you get a little bit of itch, and usually your scalp also gets tall, hardens to it and becomes tolerant of it over time. But in the interim, you might have a little bit of a situation. You just go out, you buy that. It's very inexpensive, less than $10. You can apply that once or twice a day. But generally, just enough solution to cover the affected area on the scalp, no more. A very thin layer, and then once a day for the most part. That'll be my recommendation. If you want a boost, you go with the hair pill, and that really is helpful. It's like there's no point in just dousing your scalp with so much solution. At that point, the reason why that would even be effective is because you're getting more systemic absorption. So if you're trying to get systemic absorption, which means absorption through your skin, into your bloodstream, into the deeper parts of where the hair follicle starts to grow, the root, which is deeper, then you might as well go with the pill and kind of do an inside out, outside in approach. And that's what I would recommend. I mean, generally, I think combining the pill with the solution is the best approach. A lot of women aren't going to like the solution just because they don't want to add a different product to their hair. I understand most women tolerate it well and do like it, but there's definitely going to be a segment of the population they'd rather just have the pill, and that's great. But if you can do both, that's going to be the best.
Thank you. Next question. Why does my skin respond to pigmentation so differently as I age? Do hormones play a more significant role being in my 40s?
Yeah, so we touched upon this. I mean, the principal factors, if you're talking about the types of hyperpigmentation that are hormone dependent, we're really focused on melasma. And it is related to your hormones. I mean, there's no question about it, but your hormones can be affected by a lot of different things. So everybody's a little bit different. Whether or not you become pregnant, you're recently pregnant, you're nursing, those all can affect hormones, whether you're on birth control, whether you're on hormone replacement therapy. So it's hard for me to give one answer just based on the facts that someone says, I'm 40 and I notice my pigmentation. We're saying, yes, definitely hormones play a part. We're not going to address your underlying hormonal issue at Musely. We're just going to address the skin problem. For the most part, these hormones don't cause like systemic issues. People's hormones, they change over time, but until they get into menopause or premenopause, they generally feel like they always have felt. So our goal is really to address the signs and symptoms of those changes, which are the melasma and the pigmentation of the skin. And we have a pill that can help for that because the hormones are actually it's sort of like a chain reaction. The hormones are contributing to vascular changes in the skin, which actually lead to melasma. So it's like multifactorial, but the number one thing that you can do to prevent it is the sun. And the number one thing you can do to treat it is to use the Musely kind of family of products.
Thank you. And then Yvette asked a really good question in the chat. She said, I just ordered the body cream and the bottle looks the same size as the spot cream. Will this small bottle be enough to use on arms, elbows, and knees?
Yeah, well, the body cream definitely comes, I don't remember off the top of my head, so we'll have to.
It is a little bit of a bigger bottle.
I know. Yeah, it's definitely a bigger bottle. I don't know by exactly how much. I think it's at least 50% bigger, actually. I'm not sure how big the bottle sizes are, but the amount of content is definitely at least 50%, and the team can kind of check back and give you more detail. Yeah, I mean, the issue with the body cream is, some people are going to be treating, their kneecaps, and some people have way more area. So it's tough to have one bottle that can fit like every scenario, because otherwise we're getting these huge bottles and is wasted product. It's going in the garbage. And then the other alternative is we don't have enough. So the bottle that we've decided on, I think, does the best job of addressing the most likely kind of area of skin that needs to be treated for people who do sign up for the body cream. If you find that you're using it and you don't have enough of it to last you for the full 2 months, you can always move up your refill date, and then you can get new bottles sooner. That would be my recommendation. The other thing is some people have like really diffuse hyperpigmentation. So the two options for that person would be, one, to use the pill, because that's going to treat it. But it depends on your hyperpigmentation. You may or may not be a good candidate. But for some people, you will be a good candidate. You're treating from the inside out as well. So that's going to be much more efficient. And the other option is, honestly, again, to just dilute it, to cut it with some moisturizer. If you dilute it directly, yes, you are going to make it a little bit less effective, but so maybe it will take longer for you to get the result that you want, but at least you'll be able to address everything kind of uniformly. And you just have to know that, I'm treating a pretty big area, and it's going to take me a little longer because I'm going to dilute it just a little bit. But that's a reasonable approach. Or move up your refill date.
I can say I use the body cream, and I like for my back and like all over my body. And I feel like I'm surprised by how much product is actually in it. Like,
yeah. It's like, you buy those potato chips and you open it up and then your bag is huge and then you look in, there's like no chips. Well, this one's packed with chips. So it's actually more than you might expect. Exactly.
Yes. Okay.
From Musely's perspective, like packing a bottle all the way is a better idea. I mean, it's better for everyone. It's just a smaller package. So that's what we try to do. It's dense.
Mm-hmm. Okay. Vasey, I think I'm saying it right, asked a good question in the chat. Would you like to ask it for us?
I want to know if I could use vitamin C serum before I use the spot cream, would it affect the result?
Well, vitamin C is like notoriously kind of labile. It's like a real finicky ingredient, and it breaks down really easily. So you definitely can use it. So first of all, if you're starting a Musely treatment, my general recommendation across the board, and I know people have their products I love vitamin C serums. I think they're amazing. They're great cornerstone to any kind of skincare regimen. But when you're starting a prescription treatment, these are powerful. You should kind of scale everything down. You should have just a gentle cleanser, a plain moisturizer, and a mineral-based sunscreen, and then just your Musely product. And even I'll often recommend you're going to use it every other day for the first 2 weeks. Okay. Because you want to, in my view, you want to avoid the irritation and peeling. Once you kind of get to a level plane where your skin's doing well and you're tolerating your Musely, then you can start to add back your other products. And I would do them one at a time. Now, in terms specifically of the vitamin C, I think that's a great product to apply in the morning. If you're, depending on the product that you're using from Musely, like the anti-aging is always at night. And those are the two that are probably going to be the most finicky together. So I would do the vitamin C, and most people do apply the vitamin C's in the morning anyway, I think, from my experience. So I do vitamin C in the morning and then tretinoin at night. If you happen to be using like the one of these spot creams that, you know, I would say you start the spot cream at night, but sometimes if you're not getting the effect that you want or you want to speed it up and you're tolerating well, say do it twice a day, and that's fine. Aside from the M+, which has tretinoin in it, there's really no issue combining the spot cream with the vitamin C. The Nurture formulation, which is the 6% spot cream from Musely, already has a vitamin C in it. So that just goes to show you that they're fine working together. You know, we even compound them together. But if you have your own one, which I think is a great product, you know, I see fantastic results. You know, there's a bunch of them that I like, but everyone's entitled to their own opinion. You want to have one with a higher concentration, I think, generally, that 10% range at least. You do that one in the morning.
Okay. Because this is my 3rd month with my spot cream erase. Yeah. So I also would like to know if I could only use it at night now, the spot cream, because I've been using it twice a day. So
yeah, definitely, because it's hard to tell, but it looks to me like your skin's pretty clear.
Yeah, no, it is clear, but it kind of has a red patchy kind of.
Some of the red might be from irritation from using it twice a day.
But it's fantastic. I mean, I've had great results.
That's good. You might even want to go to every other night. If you've had good results and your concern is a little bit of redness, you could do the erase every other night, see how that goes. And then depending, you know, go to just nightly. But usually for me, dermatologist is an art, just like all medicine. I like to start people off slower. I understand people are kind of in a hurry to get results, but I like to start people off a little bit slower. So they even start every other night and then go to nightly, and then as needed, go to twice a day. Some of my colleagues might jump to twice a day sooner, but the short answer to your question is absolutely. You should, in your case, I would use it less than every night, but using it nightly is totally reasonable.
Okay. Thank you.
Yeah. Great. I'm thrilled to see that you got good results. That's nice.
Thank you.
Gail, I saw you sent a really good question about the spot pill in the chat. Would you like to go ahead and ask that one?
How do you determine if you're a good candidate for the melasma pill? I've had it some since I'm 70 now, and I've had some since I was 24 after pregnancy. And previous dermatologists, they'd burn it off, they'd cut it out, they'd freezing, which I found just irritates it more. And I couldn't be more thrilled with it. People look at me and say, you know, feel different. What did you do? Nothing, but it's gone. And I think maybe I need to up it a little bit. There's still, I mean, it's not what it was, but it's still there.
Yeah. Well, again, it's hard for me to say, even if I wanted to, like in your particular case, because the picture's not that clear on my side. That's a great question to ask your individual dermatologist. I would say the people who have if I was going to order like how the responsiveness generally is, the people who have melasma, which are like the broad patches, and then usually they do start earlier. So if that's something that you've been dealing with for a long time, it would make you more likely to be someone who would benefit from it. Those broader patches of superficial hyperpigmentation, they do really well. People who have post-inflammatory hyperpigmentation, those are people who have like acne that leaves dark spots on their skin, or they have other kind of skin condition, could be psoriasis, could be eczema, anything, maybe even a burn or something. But honestly, if they have the hyperpigmentation that happens after kind of trauma to the skin, they're going to do really well. That can happen like allergic reactions to deodorants, which I see a lot, and people get these dark underarms. The ones that are more like kind of in the questionable category are like the sunspots. I think in the right circumstance, it's a worthwhile thing to try. And it kind of depends again on your skin type and that specific issue of concern. But it's definitely always something good to talk to your doctor about, for sure, through the Musely platform. Just send them a message, and maybe I'm your doctor. I don't know, because I got a lot of patients.
No, you're not my doctor. I'm thinking my doctor here in Florida, who I told him I was taking Musely because he noticed it was gone.
Yeah.
And he was one of them freezing it all the time. And that was the end of that doctor. I thought, you know what? You really were doing it wrong for me. So I have to find, the doctor online, but because we are in Florida, I like to see a live person just for that whole body inspection and everything like that.
Yeah, sure. I think it's good to combine those. a lot of times, if for whatever reason I don't think the pill, I'm not going to just give the pill to you just because you order it either. You know, a lot of times for certain types of hyperpigmentation, I'll think the peel is a better boost. So the peel is not something that we really talked about, but peel is a really good treatment. It's a 1-day treatment. Ultimately, you leave this very thick kind of, well, it's not very thick, but a thicker than you would usually apply the spot cream layer of thicker kind of a pastier cream on your face for 8 to 10 hours. And then you get a nice peel afterwards. Because that can be good for some of those stubborn spots that aren't responding as well as you'd like to the spot cream maybe, or it's taking longer than you want and you want to expedite the process.
Okay, thank you.
Sure, yeah. But your skin looks good from what I can see. It's got a nice glow to it. So I can understand why your friends are jealous, because you actually have like a nice shine.
So, okay, moving on. Carol sent in a really important question. How long do you recommend being on one medication before changing formulas if you're not seeing results?
Yeah, I mean, we kind of touched on this early on. It's a good question. I can understand because you want to see results. That's why we're doing this. We're all in this for the results. First off, I really want to be clear because sometimes I'll get people and they get like, they give up too early. You know, I'm just telling you a side story. Like my wife and we met on Bumble. It's like an online dating app. Like you got to go on a lot of dates on these online dating apps, like meet someone that you like. And my wife, she's like always patting herself on the back. I don't know why she ended up with me, but maybe that's a good thing. But well, we both are happy anyway. But she's like, I went on all these dates. A lot of my friends, they quit. Like they just couldn't take it. There's a lot of bad ones out there when you do this online dating. And she's like, but the people who are successful, who get the husband or whatever, the boyfriend that they really want, they're the ones that really stick with it. And I can tell you, like, I've been doing this for a long time. I've been really interested in hyperpigmentation disorders for over a decade. I've been studying and researching it. Aside from certain in-office procedures that are available, like certain types of lasers, there's like no other topical home treatment that's going to even come close to Musely. So if you really want to treat your hyperpigmentation, then you should stick with your Musely doctor, and you should stick with the program, because there's not going to be something that's better out there than what was offered at Musely. I mean, that's the whole reason that we exist, is that we're trying to offer the absolute best treatments. We have the deepest experience. We have the best formulation. So if after, I would say you have to give it time, 8 to 12 weeks, and you're not getting improvement, or even if like it's been 8 to 12, 8 weeks and you're seeing nothing, like you're just kind of flatlining, like that's kind of concerning. Like you should at least be seeing some progression after even a month, but really after 8 weeks. Maybe it's not huge, but it should be a little bit steps in the right direction that are appreciable, at least to you. But at that 8 to 12 week, that's when it's really important to change. But don't get, we've got the money back guarantee, and that's fine. I respect it. You want to go on here, try it for 2 months or whatever it is, 30 days. I can't remember. I think it's 60 days, and then you get your money back and you quit. That's fine. But know that you kind of cut yourself short, because you came and you signed up for this. You wanted the treatment. And I really feel like there's a really good chance, way better than even odds, that we could get you there if you stayed committed. And that's not, I personally don't, I want everyone to succeed. I mean, that's why I became a doctor. It's not really even a financial thing for me. It's just that I see people who are bothered by their skin condition, by the appearance of their skin. They want a treatment, and they're going to give up on Musely before we get a chance to make adjustments. So I think the question itself is a good one, because it's like, instead of just quitting, reach out to your dermatologist and say, listen, I'm a little bit dissatisfied. I'm not seeing the results I expected. And then be honest too, because it's like important for them to know, like, are you getting any results? Or are you getting none? Because if you're getting some results and you're at week 8, that's a different story than if you're not getting any and you're at week 8. And if you don't tell your dermatologist, if you kind of exaggerate, which I get, like I'm like a huge hypochondriac, I exaggerate everything. So it's like, I get it. But if like you tell them it's not working, or her it's not working, and it really was working, then they're going to change your whole program. And maybe that program you were on was actually the right one for you. So you want to give it a right chance. And that's basically my answer to that.
That was a good answer. Thank you. Okay, Mario, would you like to ask your question about results? He sent in a good question.
Hi, everyone. Yeah, I'm new to this product for hair growth, and I just want to know, I think you already touched on it a little bit, but how do I know it's working? Like, you just talk about like if change, but like, how can I tell, hey, you know what, this is not working, especially for men? And
yeah.
If you don't mind me adding another question, and then I'll be done for the day. When I read the instruction, it says not to use gel for the hair, or recommended. Any recommendations of what I can do for my hair if gel is not recommended? So those are my 2 questions.
Yeah, sometimes I got to go back over some of these do's or don'ts. And like I said, dermatology is a bit of an art, so everyone's kind of got a little bit of a different opinion. I think a gel is fine. I think the concern with using the gel would be twofold. If you have gel in your hair prior to applying the product, it may interfere with the absorption and efficacy of the product. And if you apply the gel after you put the product on, then it may have an occlusive effect and cause increased irritation. So I think you can use gel. You just have to kind of experiment a little bit around it and keep in mind that it may potentially lead to a little more irritation. And you don't want to put the gel on first and then the product on after, because then you'll have less efficacy. In terms of the results, you got to give it, truthfully, you got to give it 3 to 4 months is early and 6 months is good. But you should see it. I mean, this is not like, oh, I don't know, maybe. I use it, okay? Like, I don't have the full, beautiful head of hair that I'd love to have and had when I was younger. But if you were to look back at pictures that I had, and I have them on my Kirsch website, if you're ever interested, I think I have before and afters and I'm on there. It's like, I was way more bald. Like, it's not really debatable. It's like, people can't even believe that that's the same person in a sense, because there's more hair there. Like, I didn't have any hair. Like, I have way more hair than I had before. So after you do this for 4 or 5 months, you should start to feel like you have more hair. And you should look at pictures, and your barber will tell you, like, yeah, it's filling in here or whatever, and it will be better. These are the best treatments for hair also. Like, I wish there were better treatments for hair overall. This is like where the technology is. There are really good, you can get a hair transplant. You can do some other things to augment. You can do platelet-rich plasma in the office. That's going to give you a little extra marginal benefit. You can do these home lights. But the truth of the matter is the hair pill and the hair solution and the ingredients that are in there, these are by far the best ingredients for growing back hair and reducing. And what's really important is reducing like future loss. There's nothing even available anywhere else that's better, for sure. Yeah, go ahead. I think you had a follow-up.
Yeah, can I do a follow-up? So I'm taking the pill, and literally today is day 1. I just got the product. But I hear you mentioning that it's okay combining the pill and then the topic.
Yeah, I like to do that. But it really depends. For men, there are basically 2 formulations of the pill. One is just a straight growth, which is just minoxidil. If you're doing the minoxidil, you definitely want just straight minoxidil. You definitely want to do the solution too, because you're going to want the additional ingredients, particularly the dutasteride. It's a different mechanism of action. They work really well. They complement each other really well. If you're already taking the oral version that has the minoxidil and the dutasteride, then you will get better results if you combine it with the topical. But I think it's less important in that case. It will give you, the thing about hair, this is the truth about hair. You keep stacking treatments, you keep getting better results. There's not one solution for hair loss other than like a hair transplant, but then you still have to maintain it. But it's like, you do the pill, you do the solution. Maybe you do some in-office PRP. If you were really committed, then you could do the light. I never did that one, and it's kind of expensive. But the foundation, the pill or the solution, and then if you're doing one, doing the other one as well. And then you can do some other things too. But that's the bedrock foundation to doing it, for sure. And so I think combining them is good. If you're already on the one that has the dutasteride, though, you can wait on it. You don't need to jump in. You can wait. You have that one. If you don't have the dutasteride, you should add the hair solution right off, because that's definitely the right move. If you have the dutasteride in the pill already, then wait 4 or 5 months. What will happen, and again, I'm not perfect here, but it's like, oh, I saw a little bit of growth. Now I'm like excited. So now I want to add something else. Oh, I got a little bit more growth. Now what else can I add? I got too excited actually, so it backfired a little bit. But now I've brought it back down, so it's more consistent and manageable.
Thank you.
Sure.
Thank you. Okay, so we're moving on to our next topic. It's going to be specifically centered around maintaining results. Holly asked, how to achieve and maintain clear, youthful skin after 50, and what skin tips do you have for patients over 50?
Well, I think the advice is pretty much the same. If you want to have great results, it's really adhering to a program of a daily skincare regimen. And whether you're over 50 or under, it's equally important. For people who are over 50, I think the anti-aging is kind of a no-brainer, right? That the tretinoin has the greatest evidence supporting its use for anti-aging. It actually has FDA approval for that. That means it had double-blinded, randomized, controlled clinical studies that showed that it improved the changes in the skin that are associated with photoaging, fine lines, wrinkles, and dyspigmentation. Those would be the kind of the bedrocks. And then continue with the sunscreen, continue with the moisturizer, having a good gentle cleanser. Usually is about to roll out some new products for people actually in that age group. So I won't speak to that, but I would look out for them. They're really exciting. They address some of the hormonal changes in the skin that occur over time, because I think what this person is really touching on, and I do see it, at a certain point in your life, as a man and a woman, but we're talking about a woman here, the hormones really precipitously drop off, and that does have a negative effect on your skin and your hair, right? It's a measurable kind of quantifiable change that happens, over 3 or 4 years. That's a lot different than maybe any other 3 or 4 year period in your life. So at the point where you're around 50 and you're kind of that perimenopausal for most people stage, really getting in great skincare, daily skincare regimen is critically important. I know there are lots of in-office things that you can do, but if you don't, it's like going to the dentist. If you don't brush your teeth every day, then it's like, why even go to the dentist? You're just going to go to the dentist to be solving one major problem, but you're not going to get that beautiful smile. So you have to do both. So the Musely anti-aging tretinoin and then this new product are great products for people in that demographic, and then just moisturizing and sun protection as well.
Carolyn asked a question. Carolyn, would you like to ask the question you submitted about tretinoin maintenance?
I've tried tretinoin before, never stuck with it because I would get the sensitivity, the redness, the peeling. And this was when, I was going to an office, and now I've been working from home since the pandemic. And so it's more tolerable. So I'm starting again, and I feel like I'm going to stick to it because, it's a different platform. You see a lot of women and the results that they're getting and the doctor's support. So I just want to know how I can use tretinoin as a maintenance for maintenance, and also how I can. I mean, you talked about the sandwich.
Exactly, I was going to say that.
Yeah.
So this is a big problem because a lot of people are sensitive to tretinoin. By the way, it looks like you have very beautiful skin, so that's good. You're in good shape. You Musely has 3 different strengths formulations of the anti-aging cream. Okay, it's got the gentle, the balanced, and the veteran, and it's actually a pretty big spectrum in terms of the strength. Now you can choose. I'm just gonna kind of blow up in my face a little bit, but everyone can just go with the veteran in a sense, because if you're willing to dilute it, you can affect it. You can make the veteran as weak as you want it. We talked about dilution, even 10-1. If you 10-1 the veteran, which is 0.1, you're going to make it less than half as strong as the gentle, which is 0.025 or whatever. Okay. Or what, I don't know about my math on the cuff, but basically you can dilute it to as weak as you want it, but you can't make a weaker one stronger. So there's nothing inherently wrong with choosing a stronger one, understanding that if you're going to pick something strong and you're not really a veteran, you haven't used it before, you should plan to be diluting it substantially initially. And the other thing is, people sometimes, you might get cocky. This happens to me with these products too. It's like, I've gone off and on them. I mean, I'm not saying I'm better than that. I certainly have. I try and do something every day now because I like it. I like the results. I've seen the results, and it's also my job. I want to teach people, and you got to walk the walk. But in the circumstances where I've gone off and on, sometimes I'll be like, hey, I handled it. You start it back up, and then you're doing great. You had the veteran. You do it for 3 days. You think you're a star, but it's going to bite you. It's going to be too strong. Day 4, boom, you're going to explode, and it's going to be brutal, and then you're going to want to quit. So don't think because you got away with it 1 day, 2 day, 3 days that now all of a sudden you can handle something really strong. It's way better to start weak and be really gradual about it. And that way you're not going to, because once you get that irritation and that flare, that's a big problem, because you do have to kind of interrupt treatment at that point.
Yeah.
You're more sensitive, and then you're less likely to go back, and you break your kind of, you had this system that you're doing it every day. Now you're out of the habit. It really can set you back. So you're way better off. Even if you have the gentle, you get the strong, whatever one you decide to do, dilute it a lot, use it every other day at the most to begin with. If you're sensitive, maybe twice a week, then gradually go to every other day. The way I like to do it is, let's say you were to start even once a week, you're real sensitive. You had issues. You're using the weakest one, the gentle. You're doing the moisturizer sandwich. Maybe you want to be even extra cautious. You're diluting it 1-1. That's fine. You could start early. So you do that 1 day a week. You get through the week, no problem. Okay, next week you go to twice a week, right? Like 3 days apart or whatever. Then you're doing that, no problem. Now you go, so every week you can kind of increase the regularity that you're using it until you get to every day. And every day is better than every other day, even if it's dilute. So I'd rather you do it every day with a weaker strength and more dilute than do it every other day stronger. So that's definitely with this treatment. Okay. That's true with all of them actually, but specifically definitely with the anti-aging, because that's an everyday treatment. So you want to do it every day. And so do that moisturizer sandwich, dilute it, whichever one you have, way down, and start really slow and build up. Because there's no other treatment that's available. I mean, these are the facts. I mean, there is no other FDA approved prescription treatment for dermatohiliosis, which is like age-related skin changes. This is the one. These are true clinical studies. Like, you'll see all this stuff from this skincare company, that one, they got their statistics. And I'm not disparaging, and I'm not trying to disparage them. A lot of this stuff does work, some doesn't. A lot of it does work, but their studies are nowhere near as rigorous. To get an FDA approval, that process is a multi-year, $100 million plus process. And it's looked at like with a great degree of care by the FDA to make sure that, you're meeting those claims, that you actually are doing what you say you do. And so that drug actually does work. So there's really nothing better to use in terms of addressing those concerns.
If I'm using it with, the spot cream as well, I've been alternating it and just using it like, and having like a gap day. So far I've been okay.
Which spot cream do you have?
The Erase.
Okay. Well, anyway, I'm not really supposed to give specific advice for individuals, but I'll give this generally, which is to say that for the Erase, eventually, because it doesn't have tretinoin in it already, you can go to, if you're able to tolerate it, a lot of people are, to every day with both. So you moisturize sandwich, then you put the anti-aging, then you put the Erase, or vice versa, then you moisturize again. You can do that every day. If you have the M+, that already has tretinoin in it. So either you're going to just apply that M+, the spot cream, literally to spots, and then try to avoid getting the anti-aging on it because you don't really want to be doubling it up.
Right.
Or you have to alternate it, which is fine. You can alternate it. I'm saying my ideal is that you do these treatments every day. At least you're doing something every day, so that's good. I mean, if you're doing the M+ and you're doing the tretinoin, then you are getting tretinoin every day anyway.
Right. For the spot cream, doctor, is it okay to use it around the eyes?
This is a question that comes up a lot. A lot of people have this dark under around in their eyes.
Yeah,
and they really
I have
hate
that.
it. So this is a tough problem. Yes, that's the more sensitive the areas are, the more you have to dilute it. So even though this area, the cheek's doing great, the chin's doing great, the forehead's doing great, that's like a 10-to-1 situation out of the gate, no question. So I'll tell people, yeah, you can try there. The worst thing that you can do around the eyes is get irritation, because that irritation gets dark so fast. You get skin irritation, it can be very counterproductive. Like, it can make your skin worse. A lot of people, especially with a little bit darker skin type like you do, getting skin irritation is going to be a major driver of getting worse hyperpigmentation. So you don't want it. That will be highly counterproductive. So yes, you can do it, but less is going to be more. You need to be real gentle for that. You don't want to push that limit, and then, because that will make it worse. But it can help there for sure.
Thank you very much.
Yeah, sure, my pleasure.
Okay. Connie, would you like to ask your question about removing peeling skin?
Yes, I would. Okay, my face is so red right now because when I get home from working, I'm a dental assistant and I wear a mask and I can feel my skin drying. But when I get home, I want to sit down and pick every dry piece of skin off my face. And then it gets irritated. I took a Q-tip and just kind of rubbed it and it's all red. How do you guys not pick that dry skin off your face?
Picking is going to be the worst thing that you could do, just about. I don't want to say literal. I mean, there's a lot of worse things.
It's obsessing. Oh.
Yeah. The number one problem that you have, and I can't remember, but I feel like we addressed this a little bit, was that you get an irritation. So you have to dial back whatever you're doing.
Okay.
If anything, until
yeah, you don't want me to be peeling.
Yeah, because and then if you start picking, then that's going to be really counterproductive.
See how red it is? Because
it's hard to see, but I see like a general kind of red hue to it for sure. It looks almost like a little sunburn. So yes, I can appreciate that to some extent. What you need to do is you need to stop your treatment. This is for everybody, so I'm going to say it generally because, again, I'm supposed to be giving general. But you should hold your treatment. You should really just focus on moisturizing, gentle skin cleanser, and then sunscreen. And then really, you're wearing the mask too. Like, the moisturizer is kind of a protectant. It's like a barrier. So you should moisturize a lot through the day. That will be good for someone who wears a mask.
Okay.
I don't think you're going to need it. You could go out and buy like a 1% hydrocortisone cream. It's like less than $10 at any pharmacy.
I have that. My dermatologist told me that.
You can use that once or twice a day until your skin is back to normal. And then regardless of whatever treatment that you're using, you're going to want to really dial it back. Just like I've been kind of talking about, it's sort of almost been the theme of today to some extent. less is more. Here's you know what? This is a great analogy again with the gym. I'm not a good runner.
I'm impatient, very impatient.
Me too. So all of a sudden I decided I haven't run for 10 years, but I'm going to go for a run, but I'm not going to run for 10 minutes. I'm going to run for an hour. And now I come home and every joint hurts. My feet hurt. There's nothing on my body that doesn't hurt. And then all of a sudden, like, I'm done with running. I can't run anymore. So it's like super counterproductive. It's like, if I just done like a little jog and then gradually do it, then I'm going to get way better results.
They can hear you. Okay.
Yeah.
Okay. That's why it's all red. I took a Q-tip with some moisturizer and kind of rubbed all the dead skin off, but now it's like burning, hot.
Don't do that. Go ahead and use the hydrocortisone. Use a moisturizer, and then make sure, like, this is another area that people get a lot of trouble with, is if you're using any kind of other products that exfoliates your skin. Salicylic acid. Okay, that's good. But yeah, if people do that, the combination, it's like, yeah, I did great. I used to use this product and that product, and now now it's this Musely is the problem, but it's really like the combination. Or maybe I use Musely as perfect, no problem. I use this as no problem, but now I use them together. So it's very unpredictable how these different products will work. That's why I always say, simplify it initially, gentle cleanser, plain moisturizer, no fragrance, zinc or titanium dioxide based mineral sunscreen, very simple. Musely, dilute it every other day, titrate it, stay on the lower end instead of like pushing it. And then once you build up your Musely tolerance, then you can add back some of the products.
Because I want it done like yesterday.
I know. So I know how you feel. I want everything done yesterday.
Yeah.
Okay. My wife's by the way, she's a dental hygienist, but
I'm a dental assistant. So.
Yeah, that's cool. But yeah, we all want it done yesterday.
Yeah. Okay. Thank you. I need to relax.
Yeah.
Stop.
Yeah, you're just and then the picking, like, I don't like the picking is the worst. So don't pick. You don't have a real picking problem, but I see people have a real picking problem. And there is a medicine that I do recommend.
There's worse people than me.
People that really pick. And,
Okay.
sometimes we see that, and I have some tips for those people. Cystic NAC or whatever. I can't remember exactly how to say it on the spot right now.
OCD? OCD?
NAC, no, it says medicine NAC. Yeah, your OCD is the picking. Yeah.
Thank you.
All right. So that wraps up today's office hours. I'm sorry if we couldn't get to anyone's questions, but this was great. It was.
I just want to say one quick thing. Like, it was so encouraging to see all the smiling, nodding faces. You guys really, I don't think you appreciate it. It's very helpful to me, and I feel very supported. I like to help everybody, and then to see people that are enjoying themselves and smiling, that made this experience so nice for me. So I really want to thank you, and the questions were great, and I appreciate you all joining us.
Hey, can I say one thing? I used a Baji to get rid of my melasma, and I probably spent $1,000. Did not get the results that I have gotten from Musely in probably a month and a half. So I am so encouraged by my melasma. This is awesome.
That's wonderful.
I appreciate it. Thank you.
Thank you.
Thank you, Connie. Thank you for sharing that. That was awesome. You've been incredible. All right. Yeah. Thank you everyone for participating. Yeah. And for showing your smiling faces. I had a good time. Hope everyone else did. Thanks for engaging. And yeah, thank you, Dr. Kirsch, for your time as well. Yeah, we'd love to connect with everyone on social media. So if you're not following us already, you can find us on Instagram, TikTok, YouTube, some other places at Musely. And we really appreciate everyone for joining us tonight. Thank you so much. Hope you have a great evening.
Thank you. And everyone's skin looks great.
Thank you, doctor. Thanks, Mia. Bye.
Bye.
Bye, everyone.
Bye.